In the past, we were discussing diagnostic tests that look at structure or Im imaging structures in the brain, whether the brain structure or the blood vessels in the angiograms. We also talked of how we analyze the cerebrospinal fluid. In this section, we now will go into some electrical activity or measuring electrical activity. As you know, neurons transmit electrically within each neuron. So the next tests are actually based on measuring electrical activity. The first ones are called evoke potentials. In evoke potentials, we measure the activity of the stimulus passing through certain tracts in the nervous system. And we use 3 of these, okay? And in all these 3 areas, we measure speed of transmission in the pathways. Basically, if the pathway is intact, transmission is very fast. So we know the exact amount of speed of transmission in each of these pathways that are being measured. If there is a delay in transmission, this will indicate that there is probably some damage along these tracks. So there are 3 major evoke potentials that we look at: vision, hearing, and sensation. So vision, hearing, and sensation. The first one we'll take is visual evoke potentials. The visual evoke potentials measure the speed of transmission of light the moment it enters the retina until it reaches your primary visual area, which is area 17 of the occipital lobe. And this is most commonly abnormal in patients with multiple sclerosis. So these are examples of your visual evoke potentials. So the patient will wear either goggles or they can look at patterns or which are flickering patterns on a screen, okay? And then there is an electrode at the back of the head which will measure the speed of transmission. The next one will take measures hearing. And hearing is measured by your brainstem auditory evoke potentials. So or for short, BAER. Okay, because another way to say it is brainstem auditory evoke response. So this measures the speed of transmission of your auditory pathways. So you measure how long it takes for what you hear to reach your temporal lobe, your superior temporal gyrus, where your primary visual auditory area is, your area 41. It is divided into 5 segments because the first 2 segments actually is not inside the brain, but it is actually in the cranial nerve 8 and also in the ear area after the tympanic membrane. So it's only the last 3 segments that will really measure the tracts inside the central nervous system. As I said, for short, we call it BAER because it's also called brainstem auditory evoke response. And here you can see that you wear earphones, which makes a clicking sound. And it makes a clicking sound, you measure. So this is number 1, number 2, and then this is your 3rd, 5th, so 4th is somewhere here. So you measure how fast transmission takes place. There is an electrode that is put near the temporal area. Okay? The third evoke potential measures sensation. Sensation is measured by your somatosensory evoke potential. This measures the transmission of pain stimulus through your lateral spinothalamic tract. So what we do is we put a electrical stimulus in the arm, then we have electrodes in the various areas on top of the spinal cord until you have it in the cortex, because the final location of this is your parietal lobe, specifically your area 312 of the cortex. Okay. The next one also measures electrical activity. If the evoked potentials measure the pathways, spinothalamic tract, the auditory pathways, and visual pathways, this test called the electroencephalogram measures also electrical activity, but electrical activity of the cortex. Okay, so this is of the cortex, and for short we call it EEG, electroencephalogram. It looks at the voltage. So what you see here, you have different lines because each of these correspond to different areas of the cortex. And you see the brain waves there that we can count how many hertz in a cycle and the voltage. Can measure it. Its primary use now is to look at patients with seizures to see if there's an active seizure activity. Sometimes it's used also to determine the seizure type. And we can also use it to look at background electrical activity of the brain. Example, you have a patient who's in coma. You want to see sometimes how bad the electrical activity is or whether there's good prognosis when you have very fast electrical activity of the brain. We also use it in determining brain death. Okay, this is what you call the isoelectric EEG, where you have your flat waves. This is your flat lining for your cortex using the EEG. So these are the various uses we have for EEG. Because there are many channels, you can actually localize where, let's say, a seizure activity comes out. You can localize where it's coming from. This is how you connect the electrodes. This one is actually more than the standard clinical use. They use this in research, but about probably 60% of that is used in clinical setting. We still have a lot of electrodes that are put on top of the head. That's why it takes a longer time sometimes setting up these electrodes over the actual recording, because you have to measure the distance between each electrode. So the EEG electrodes are usually put on top of the head. However, it's possible, like in this case, surgically they put a mat inside. This is for localization prior to epilepsy surgery to really find out what specific areas are the seizure activity coming from. Okay, so that can be done. All of them go into a machine that are connected to your EEG machine. Nowadays, we use the digital EEG. So in digital EEG, it's connected to a computer. This is the computer box where you plug in all the electrodes. All the electrodes are there. And you can record it in the computer, so it's very easy to print. In this area, you see an area of normal activity over here, followed by this area, which is a seizure. So you can see that it spikes up. Okay, you can see how high the spikes are as compared to this area where you have very low voltage. Okay, so we can see that in digital EEG. And this can even be emailed to you, and you can read it through your computer. A very far cry from the first EEGs that were available in the past. This is one of the older EEGs. It still uses paper. There's paper which is laid there. And over here you see styluses. Okay, these styluses, like in the polygraph machine, will write. There's ink that will write on the paper. It can go up and down, up and down, up and down this way to record your EEG. But you have to set manually the sensitivity and the gain with each channel with this. This is just a picture of all the wires going to the electrodes that you have to connect. The next test is also measuring electrical activity, but this time it measures the electrical activity in the peripheral nervous system. And this is called your electromyogram nerve conduction velocity test. So electromyogram nerve conduction velocity test is also known as EMG NCV. Okay? The NCV, or nerve conduction velocity, actually measures transmission in the peripheral nervous system. In this picture, this is a nerve conduction velocity. You put a recording electrode here. So you give an electrical stimulus first in this area, then second here. We measure the distance between the stimulation point and the recording electrode point. So we have a distance. Then the machine can measure the speed of transmission, how fast it takes for the transmission to go from here to the recording electrode. So you have speed over distance. You have time over distance, and that is speed. Okay, how fast it takes, time over distance, which is usually measured in centimeters. The second part is the EMG or electromyogram, wherein you put needles in each muscle. So there are recording needles that you insert in each muscle, and this can detect the electrical activity of the muscle. Combining nerve conduction velocity results and electromyogram results, we can determine whether there is an abnormality in the muscle itself or in the peripheral nerve itself. And with certain tweaking, you can determine whether it's mainly in the myelin affected or in the axon itself. Okay, so these are the uses of your EMG NCV. So now it's basically measured again by computers. This one, they're doing the nerve conduction velocity. That's an electrical stimulus, except that I don't know why the guy is smiling. In my experience, whenever we did the EMGs, nobody smiles. In fact, this is the first part, nerve conduction velocities, electrical stimulus. When you start introducing the needles in, nobody smiles. They will beg you to limit the test, to do as little punctures as possible. So we leave the electrical tests and now go into some newer tests. One of the newer tests is ultrasound in nature, and this is your transcranial Doppler. Your transcranial Doppler using ultrasound technology, this is the sensor, can now penetrate the skull because previous ultrasound could not penetrate the skull, and you can see the flow in your blood vessels. But what's the difference between angiogram? The difference in angiogram is it looks at real-time flow, the blood flowing. Angiogram looks at the blood vessel, not the blood inside. Transcranial Doppler real-time means as I'm putting the electrode, whatever I'm seeing is happening right now. Okay? And you can look at both anterior and posterior circulations. You can even see microembolism being thrown. So I like this test as a way to screen patients with potential risk of strokes, especially hypertensive and diabetic patients. Sometimes it's nice to show the patient that, look, this is your results, very slow flow. Stenosis, meaning you can see already stenosis of the arteries. So you're at very high risk. Okay, so this is a nice test that can be done. Okay, again, as in everything, there's a computer that just records it. And what you need is a transducer of what you put on into the head. We also have beginning now transmagnetic stimulation, TMS for short. TMS, transmagnetic stimulus, looks at magnetic activity of the brain. Okay, this is not yet in standard clinical use. It is used in research for diagnosis to look at neural circuits, and it is now going to therapeutic use where you can either stimulate or activate a part of the brain or inhibit it. And we use this a lot in neuro rehabilitation for retraining neural circuits. This is non-invasive. There is a the magnetic coil is put on top of the head, and it's relaxing. So these are how the magnetic coils look like. So you just put there, okay? So yes, this is correct. You can smile when that's happening, at least especially if you know that they're activating certain brain circuits, and then you should be happy about that.